Welcome to Tammany Tech 101. I'm Grant Black, Director of Technology for St. Tammany Parish Government. Increasing access to high-speed internet is a priority for President Cooper. St. Tammany Parish is a beneficiary of millions of dollars of federal grants to improve access to broadband in our underserved communities. With that, we want to ensure that our citizens grow in their digital literacy. Today on Tammany Tech, we talk to Pablovich, Community Health Coordinator for St. Tammany Parish Health System. Welcome, Ann.
Hey, thanks for having me. Thank you. Happy to be here.
When we started this over a year ago, you were the first one to come back. You had a plan. You were ready to go. I mean, you've really been helpful with this effort, and I appreciate it.
Oh, I'm happy to help. I think it's an important topic and one that's really been highlighted recently with the pandemic.
I certainly agree. So we look at healthcare. When I think of broadband, I guess I don't really think of healthcare being one of those industries that really brings it out. But as we've gone through this, I mean, it really has.
It is very, very much highlighted by the pandemic of how broadband impacts health outcomes. We talk about social determinants of health and how environmental factors and things that happen in our communities can impact people's health outcomes and health measures. And we've found that broadband is kind of a super determinant of health. It really has a strong correlation and a strong impact on how healthy our community can be.
So when we look into, talk about broadband impacting healthcare, so what are some of the things? I think you brought up MyChart was one.
Yeah, so it's interesting. There's a huge gamut of how we utilize technology and how broadband impacts that in healthcare. One of the things is an electronic medical record like Epic, and then tools like MyChart, like you mentioned, being able to access your personal healthcare, being able to communicate with your providers virtually. That's a huge benefit to patients all over the world. Telemedicine is a booming new component of healthcare, and that's one that was really highlighted by some of the closures and the shutdowns that we experienced during the COVID pandemic. And it brought forward the ability to really pivot and use that technology so that people aren't going to miss care. They're not going to miss their appointments with their physicians when they need to. Because you have the technology, and it just kind of pushed that into the forefront so that people felt comfortable using it. Other ways that we can use broadband and have an impact in healthcare are with access to specialty providers for people that live in more rural areas. They may not have access to transportation to travel several hours to a clinic that's got a really respected and high quality care, cardiologists, for instance. If you need specialty care, being in a rural area can really hinder your access to quality providers. And so those are just a few of the examples of how broadband impacts healthcare.
My father-in-law was in the hospital recently, and it was really interesting because he was in Metairie, and my wife used the MyChart app, and she could see when the doctor had come by, whether he got medicine, or even doctor's notes, which I wasn't available. I didn't realize that was available inside of that chart, that MyChart app.
It's so comprehensive now, and such a great asset for patients. It really can engage them and allow them to be better advocates for their own care because they're interacting with their physicians and their care team. They're posing questions. Sometimes when you're in that appointment and you've got 10 minutes with the doctor, you don't remember all the questions that you thought you would remember in that appointment, and sometimes you need to go back after hours and say, I forgot to ask about this, and MyChart really gives you that opportunity to connect with your care team, send a message. If it's not urgent, they can get back to you, in an hour or two, and let you know what you need to know about your care plan.
And I think that's a great point, because a lot of times we'll be in the doctor's office and they're prompting you, and you almost miss your questions. But I think with that messaging portal, I know I've used that before, where I've gotten out the office and I'm like, I meant to ask about this. And you send that message and it comes right back. The responsiveness of the team, I mean, is that one of the goals of St. Tammany Parish?
Absolutely, absolutely. All of our providers, strive to be responsive. That's, a huge component of good quality care. And so whenever you're trying to play phone tag, for instance, not everybody answers their phone if they don't recognize the number. Or, you've got your hands full, especially as a mom of young kids. You've called the pediatrician, I've got a question about their medication, and then you miss the call, and you've got to call back and then the nurse is going to call you right back. So it's tricky sometimes whenever you're playing phone tag.
Yeah.
A simple message through that MyChart app can really take away some of those pain points.
Coordination between the medical team as well. So I mean, if you have one doctor over here that prescribed something or had something they've noticed, other doctors within the system have access to that as well.
Absolutely, right? That is a huge component of why people use systems like Epic, so that everybody's on the same page. All of the providers know exactly who's prescribing what procedures are pending, what the patient's history looks like. So it really makes everybody, brings them to the same page to provide the best care for that patient as possible.
So we're going to do expanded access to care, virtual visits and those things. I know probably a lot of us have had a sick child at home in the morning trying to figure out, okay, let's call Teladoc, let's try and get this done, get a virtual appointment quickly, and you're trying to figure out where to go from there. So it's almost like that's kind of been something that's been, I guess, extended version of like urgent care or something like that. So I'm not having to go check out a child who's not feeling well out and to potentially risk him getting more ill or catching something else.
Absolutely. One of another great perk associated with having broadband access and really highlighting the need for it is virtual visits. We have a clinic called Virtual Care Now with St. Tammany Health System, and we have dedicated providers that's all they do, or they cater to patients that cannot get into the clinic for whatever reason. If it's transportation, that's a huge challenge here in St. Tammany Parish specifically. We've got a lot of mileage and geography to cover, and transportation can sometimes be a barrier to care. So providing those opportunities for virtual visits is really important. And just for what you mentioned, not exposing someone to the elements or to contagious environments. Sure. You don't want to share what you've got, and not every illness or issue is going to be appropriate for virtual care visits. But there are certain things like pink eye. That's an easy one. A doctor can see what's going on. They can call in the prescription, limit your exposure to other people. And it's a good solution for all. So our providers offer that. Like I said, we've got 2 dedicated providers for Virtual Care Now. It's an easy appointment to schedule. Same-day access is a really important piece of ensuring adequate care to our patients, and that's a big driver for these clinics.
Well, I think that it seems to be like a shortage of medical professionals. I mean, it's just the industry is getting harder and harder to bring people in. So I think
Absolutely.
That's a great option to kind of mitigate some of those issues.
Absolutely. So you call your regular primary care. We can't see you till tomorrow or the day after, but you've got this issue that you're pretty sure you have a good idea of what it is. Maybe it's a sinus infection, a UTI, pink eye, something of that nature. And you call 898-4001, get an appointment with one of our providers that offers these virtual visits, and you're on your way. You're feeling better within 24 hours, and that's a great outcome for a lot of our patients.
Because the prescriptions go out, so I mean, you just all you have to do is have the child sit there on the tablet or whatever it is while they're doing it, and then go out and pick up the prescription. I mean, we've used that service. It's been a great experience.
Absolutely.
All right, so remote monitoring, what is remote monitoring?
Yeah, so remote monitoring is helpful for some of our chronic condition patients, whether they've got a heart condition or they're an oncology patient and they're undergoing chemotherapy. There are devices that now communicate with your electronic medical record. So for instance, with oncology, the St. Tammany Cancer Center, we offer chemo care companion packages. So any new patient that's undergoing treatment with us gets a kit, and it's got Bluetooth connected devices that are, I think they're called iHealth devices, and it's a blood pressure monitor, a digital scale, and a digital thermometer. And you're prompted every day to take these measurements and to answer a series of questions about any symptoms that you may be having, any side effects that you're experiencing from the treatment that you're undergoing. Chemotherapy and radiation can provide a lot of adverse side effects for patients, and so sometimes they can create some real unsafe conditions for that patient, which requires hospitalization. So if we can monitor and have a good track record and a good look at how they're doing every single day, and if they've got any sort of issue with nausea or vomiting or anything like that, their care team sees that. They get those updates as they're tracking their symptoms and their condition, and they can intervene before a hospitalization is necessary. So I think there was a recent study of how this chemo care companion package is working, and it was done on the South Shore with some patients, and they reduced unnecessary hospitalizations by 30%,
wow.
which is huge. When
that's a big deal.
When you're undergoing treatment for cancer, that's a huge benefit to the patient. So anytime you can get more information and have your care team see how you're handling treatment and some of the challenges that you're going through.
As a patient too, I think it's hard sometimes to realize, when do you call, when is this urgent, is this a problem?
Right.
I think having that, it seems somewhat, while it could be a little bit intrusive, really non-intrusive, that it's being done kind of transparently, externally,
yep.
and the doctors know when to come in and help, as opposed to having the patient make that decision.
They can spot those trends of what's going to be concerning, and you know, there's some top symptoms and side effects that really can cause that patient to go off the rails pretty quickly. Yeah. And so if they can spot that ahead of time and course correct, then it's a win-win.
So does it notify the medical team of the trend analysis and those things?
Absolutely. So the care team gets those alerts when the patient is completing the surveys, and when they're adding that data into the system, it notifies their care team so they can take proactive steps and not be reactionary to these.
So do you get reminders to step on the scale throughout the day?
Absolutely. And it's just once a day.
Okay, so once a day you step on the scale.
Yeah,
okay.
You're just monitoring, to kind of track that trend. Okay. And similarly with some of our cardiologists or cardiology patients. Yeah. Similar symptom management and some of those biometric measurements. They want to keep an eye on those closely, so that if you see a spike in blood pressure, that can be addressed. And do we need to adjust medications, or is there something more serious
going on?
So are you
wearing a cuff all day with the blood pressure monitor?
No, it's just prompted at various times of the day, and those readings are uploaded to your chart. So it's not really a burden on the patient to report out what their readings were. It's all done electronically and with the use of broadband.
Well, it's really impressive.
Yeah.
So all that goes, is it Bluetooth, or does it connect into Wi-Fi, or what is the?
Yeah, so the devices are Bluetooth devices, but you would have to have a connection to, allow it to upload back to your chart. So it's pretty remarkable, the technology that we've come a long way.
It's very impressive. I mean, like I said, we don't go to the hospital all that often, but kind of become a caretaker for an elderly person. I've seen a lot of these things in action. It's very impressive to see. I mean, I think the treatment he's gotten has really prolonged his life. And,
absolutely.
But not only prolonged it, but really give him a higher quality of life. That he had a heart attack. It was identified very quickly, and he was moved. And I think look at all the monitoring analysis that was done really improved.
Oh, absolutely.
The outcomes.
Absolutely.
So virtual social connection.
That's another area that was really highlighted during the pandemic was sheltering in place and staying at home, and particularly in our elderly population. That social interaction and engagement and connection to a community is so important in that population. And there's absolutely a connection between that engagement and social well-being. You can't have a healthy person if they're not mentally well. Sure. And so feeling isolated and disconnected from your family and your loved ones was a real challenge. And you saw just a huge increase in some of the adverse effects of that as we got through the pandemic. And you had to start to outweigh the risks and the benefits of being isolated and trying to keep yourself protected from the risks out there. But then patients were really struggling with those feelings of being alone. And so connecting with their family members and their loved ones, either you couldn't see them in person, but you could do a FaceTime call and you could check in and still connect. Sure. Having virtual support groups for people that were experiencing challenging loss. Bereavement support groups was a change that we saw in some of the outreach that we do. But being able to connect with people virtually instead of just saying, I'm sorry, you can't, you just got to stay home. That was a much easier adjustment to make. So, But without broadband, you had limited ability.
I know my grandparents were in the hospital, Sauer Memorial, during the pandemic, and it was such a blessing. The nurses and the staff would FaceTime with us. They basically call from their phones and FaceTime. I thought, man, this is such a nice. They're just very aware of that need for social interaction and the healthcare outcomes that come from being socially connected to your loved ones.
Absolutely, seeing someone face to face, you can often get a better read for how they're really doing. You can disguise a lot in your voice, and you can try to put on a brave front that I'm doing okay. But if you see somebody and you connect with them and you're looking into their eyes, then sometimes you get a different story. Sure. And so being able to use iPads for loved ones that were hospitalized was a huge benefit to a lot of families across the nation during COVID, but also just in general. I know my kids connect with their grandparents all the time on FaceTime and the messenger apps on their little tablets. And so it's a benefit to my kids because they're connecting with their grandparents, but it's such a better benefit for the grandparents because they're getting, they're being thought of and they're being called by their grandchild, and it's just a bright point for their day.
Yeah, it always amazes me when you look at healthcare outcomes and some of these almost side factors of social interaction, just getting information, and some of that feedback that you get from from like we were talking about with the cancer patients. When you get the feedback of I see I'm losing weight, then you start I need to start acting differently, and I think a lot of this information really helps us just process how we can get better. Are we doing better? Are we doing worse? And do we need to call the doctor? Because I think, I've had medical issues, and you'll kind of almost lie to yourself of like, well, I'm doing okay. Yeah. And I think that feedback and these tools just really is helpful.
It absolutely is, and seeing the focus that St. Tammany Parish government and you guys are putting on broadband access and expanding that in our community it's a huge benefit in so many areas, but specifically for healthcare and health outcomes. A lot of the programs that you see in some bigger cities are harder to implement here because of those challenges. So we talk about virtual care now. A lot of those video calls have to be converted to audio only calls, and you lose a certain ability to really treat the patient as best you can when it's at a decreased level of connection. And so we're certainly appreciative of the importance that y'all are placing on this in our community, and just want to support it in any way that we can.
But that's a large part we're doing. A lot of times when you don't have access, you're not aware of what's out there, you don't miss it. So we're trying to get information out and say, here's what's available to you. This can help your life. This will improve your quality of living, your standard of living. Because if you don't see it, you just don't know. So that's a lot.
And you don't utilize it.
Exactly. So you guys are doing a great job. We really appreciate everything the healthcare system and St. Tammany Parish Hospital and your group's doing with as far as getting information out there and spreading this knowledge, because it's a great thing, and it's really important to get the information out there.
Well, we are happy to play a role, and just thrilled to be able to have the opportunity to do so.
Okay. Well, thanks for coming on in. I appreciate you being here today.
Thank you for having me. It was a pleasure to chat with you.
I'm Grant Black, and this is Tammany Tech 101. I want to thank you for joining us today, and look forward to you joining us for future episodes.